All right, practice owners always ask me, how long does it take to implement RTM? Right, I don't have months to spend on this. They're busy, staff's busy, and the answer is really about 3 to 4 weeks from decision to first patient enrollment, I think is what I see on average. But let me break down exactly what happens in those 3 to 4 weeks and how much time it actually requires from you and your staff and what the timeline looks like month to month. All right. My name is Dr. Andrew Grecki. I'm the owner of MovementRX. In my opinion, the best remote therapeutic monitoring software for physical therapists, occupational therapists, speech pathologists. But I want to give you a realistic timeline, not just a sales pitch, right? I work with clinics all over the country. I help them with their onboarding and implementation. And, first I want to talk about what does this 3 to 4 week implementation timeline look like and how are we involved and what are you involved with, right? So here's what actually happens, right? From the day that you decide to implement RTM to the day that you enroll your first patient, let's just say, all right, week one, okay? So week one, we're going to set up your account, right? We're going to give you training documents. We have a complete implementation guide. So that first day or two is account creation. You provide us with your practice information, and we create an account in your system, adding all your providers, all their information. We brand it for you. We put your logo, your colors, your practice name. All of it's branded for you, right? So that time requirement in that first couple days is about 30 minutes. Get all your provider information, okay? We've created the account. Now, days 3 and 4, that first week, I would say you're sending us a list of all your providers, their names, emails, license number, NPI number, and then we create individual accounts for them. And each provider then receives a welcome email from our software. And that welcome email gives them the ability to create their account. They log in with their credentials. They set their own password. And again, how much time? It's about an hour, right, for you to gather that information. And so as we get towards the end of that first week, now we have provided you with materials and you have self-paced training, right? We give providers this implementation course. It's about 2 hours from beginning to end, and it covers how to create home exercise programs in the system, how to enroll patients, what documents to give them, what documentation they need to have in their notes, and they can do this all in their own time. But it's about a 2 hour, maximum 2 hours for them to do. So that's your first week. Then we have a meeting on Zoom about this. So we go through this. Then week 2, we have a leadership and a clinical training meeting, right? So that's typically going to be about a 60-minute thing where the owner attends, the clinic directors, the lead therapists, and we talk about what are the documentation requirements and how can you change your templates in your EMR, right? We want to minimize provider time. We want to create systems and workflows, and we want to be compliant with billing, right? And also what patients are appropriate for RTM and how to introduce RTM to patients. That whole process is about 90 minutes, okay? And we do that on Zoom, and then you meet with your staff as well. And we want to have the leadership team in that meeting. So that week 2 is leadership meeting, and we get you set up to be compliant, and you have systems, right? And again, I answer questions, or my team answers questions from those videos in that course, and we walk through the software together. So I actually show the providers how to use this. We practice patient enrollment. We're reviewing scripts to introduce RTM. And again, that's about an hour. So week 2 is about an hour. Week 3 is typically meeting with the billing team, right? So as we get close to having claims to submit, I want to talk with the billing team, and I want to talk about how to understand the unique behaviors of these RTM codes. And I want to know how to submit these claims through the EMR or through the clearinghouse. We want to track reimbursements. We want to know how to handle denials, and we want to know what the heck's going on. So it's about an hour, right? It's another hour, week 3. Then week 4 is typically the soft launch. So in that week, we typically start out with, first few patients that are enrolled. The providers start offering RTM to the appropriate patients whose insurance covers it and they've had an authorization, right? So they know if there's any out-of-pocket costs, which most of the time there's not. And our goal for that first week is each provider enrolls about 2 to 3 patients. And then we're monitoring closely and providing support. And then towards the end of that week, we do a check-in, right? And we have a quick team meeting, what's working, what's not. We address any confusion or obstacles that your providers might be having. Their mindset might not be right. They might be feeling bad about, something that's going to be charged to the patient's account. We adjust any processes that might be needed to be adjusted. That's about 30 minutes, right? So at the end of 4 weeks, you're live. Providers are comfortable enrolling them. They're feeling good about it. Patients understand what's going on. And your patients are using the app and they're getting their home programs on their phone. And now the first monitoring calls are happening, right? So that required each month. And that is the typical time over 4 weeks, right? Is for the owner, we talked about 3 to 4 hours for the entire process, right? For the biller, it's about an hour. For the providers, it's about 2 to 3 hours. That's it. So less than 1 weekday, one work day spread over a month. And so that's a great thing in that first month. Not as much as you would think, right? Now, as we get to the month to month after things the processes are working, I want to show you, what that growth timeline typically looks like after implementation. So we don't just go away. We don't just give you the software and the training and say, okay, see you later. That second month, right? We've gone through, the first month, well, we already talked about, we've gone through the enrollment, the training. By the time that first month gets over with, we typically have, 20 to 40 patients by the end of the month. And billing's happening, right, the following month because we're waiting for those codes to be eligible. And so there's a bit of a learning curve, right? There's uncertainty, but it's all manageable. And then when we get to that second month, we now are looking at patient enrollment, usually 60 to 100 patients, adding 40 to 60 new patients a month. Revenue, by the way, is about 3,000 to 6,000 now, right? And the staff sentiment typically is they're getting more comfortable. They're seeing it's not as hard as they thought. Like I've heard, is this it? It's like, yeah, this is it. That's a good thing, right? So that key milestone, that first reimbursement check arrives, and this is when it becomes real. And that's typically at the end of the second month because of the way the codes are set up to have that delay. Then you get into month 3, and typically we're looking at about 150 patients, adding 40 to 50 new patients a month. Revenue is now 10 to 16,000 a month. Staff sentiment, I can notice it's becoming routine. It's part of their normal workflow. And I think the milestones that we see are that staff start seeing, patient compliance increase. And we actually have a tracking system to show your staff the patients that are RTM versus non-RTM and how their engagement is going up. Then we get to month 4, and typically the enrollment continues to go up, right? We see about 200 patients a month, and revenue is now 16 to 24,000 a month. And the staff sentiment is really now it's fully integrated in the workflow. I'm feeling really good about this. And the key milestone is the revenue is significant enough now to notice practice finances, right? And so now that usually happens about 4 to 5 months in. You're like, this is really a big opportunity. And again, as we continue to grow our enrollment, we typically see that, stabilize around 5 to 6 months. And again, staff sentiment is this is just how things are now. That's how it is in my practice. It's normal. I can't imagine not doing this. And so that 5 to 6 month mark, I think, is when things really get to be smooth. And, the directors and the managers, the owners are really not, having to do much at this point because things are rolling. And so I love hearing, I can't imagine not having this. That's an important place to get to with a clinic. Where revenue is stabilized and it's predictable and, everything's predictable at this point. And so, I think it's important to realize that we fear that this is going to be this big, big change. But in reality, making a home program for your patients is that's what providers are doing already. So as long as you take as much of the responsibility off of them, don't put this on them, put it on the clinical directors and the billing team and don't put this on the providers. As long as you're doing that, it's going to go really well, right? And so now what slows down implementation is important. Some practices take longer than 3 to 4 weeks. I've seen practices take 3 to 4 months to get this kind of snowball rolling. And I think the number one reason that I've seen over the last 3 years is they don't have a dedicated champion, right? If the owner's the person who's, treating 60 patients a week, and trying to implement RTM in the spare time, it drags out. And I've seen that happen a lot. So the real solution there is you got to designate someone in the clinic, whether it's a director or a lead PT, or office manager, somebody who owns this, somebody who is going to get to know this and learn from me and my team how to do this right. Another big thing that slows things down is staff resistance, right? If staff aren't bought into this, they're going to drag their feet on training and enrollment, right? So how do you get staff bought in? It's not financial. It's going to be how the benefits to the patient, which I think is really, really important. You've got to address buy-in issues before starting implementation. So have conversations, have discussion, healthy conflict. Why do you feel like that? Another reason I see is trying to be perfect before everything starts. Some owners want to be really detailed and perfect before enrolling the first patient, but the reality is it's a learning curve, right? So you got to start with a pilot, I think is a solution, a group of people, and learn as you go and adjust as you go. Another one I think is waiting for the right time. I hear that a ton from people that are just doing consultation calls with me. Oh, we'll start after the Q1 or the holidays, or just hired a new PT. We got too much going on. It's the reality is there's never a perfect time. It's just like having kids. There's never a perfect time. You just got to start, right? You just got to start. Another big one I hear is doing it completely on your own. That's a big one. I think if you're doing it on your own, you're trying to figure this out without guidance and support, you're going to fail. I've been doing this for 3.5 years. I can help you with this, right? The solution is to work with a vendor who provides implementation support like us. And by the way, we do this in our own practice as well. So it's not just like theory by some tech company. It's actually what we're doing in our real practice. And we have a dedicated champion. We have staff buy-in before we started. We are willing to, start imperfectly and we adjust it. And so you have to have a vendor who has really strong support, right? And you should commit to a 3 to 4 week timeline, right? Don't commit to 6 months. That's too much time. There needs to be clear ownership of the project. Staff resistance wasn't addressed. That's going to be an issue. If your perfectionism or overthinking is going to mess you up, if you're trying to do all yourself, it's going to mess you up. Starting and stopping multiple times, I think that's also a big thing. When a problem occurs, just tackle the problem. Don't stop and abandon ship, right? And I do think that we want to talk also about like what are the ongoing time commitments like after we're done with all this implementation, right? Once it's implemented, the ongoing time frame and requirement for providers really should be not a lot, right? They're enrolling patients in 2 minutes in the software. They're creating home programs. They're introducing this concept verbally. They're talking to the patient about what this is going to be like. That can happen in a normal session. So it shouldn't be like a big burden to the providers. And in your documentation, you can set it up. There is no documentation requirements except in the plan of care and your progress notes. So as long as you set that up to be template automatic, there shouldn't be anything there besides creating the home program. And if you do it the way that we do it, where we take custom videos on the spot, it's so fast. But occasionally they'll get messages, from a provider, about a patient concern. That might take a minute or two. Like if there's a red flag, maybe the PTA in your office or one of our remote PTAs called the patient and they had a red flag. Yeah, that's going to be communication time between the remote PTA and the provider in the office, right? The billing team, that typically takes about 30 to 60 minutes a month to review the claims before they submit them. I mean, it's not just like the rest of their claims. So it's really not that big of a difference, right? They might get some denials. They're going to handle those. And from the owner's perspective, for me, it's 15 to 30 minutes a month where I review things. I look at the numbers. I look at, the revenue that comes in, check in with the team. That's it. And so to me, it's awesome, right? So once it's implemented, it's running in the background with minimal ongoing time investment. Now you compare this to other revenue streams like cash-based services, right? For me, we have those. And so there's ongoing marketing time. There's reviewing, are we offering these trials? Are we getting people to buy packages? Have we paid for the laser? People want to go to classes to get their dry needling certification. Are we actually selling enough of that to then cover the cost of those courses? But RTM is minimal, 1 to 2 hours a week for your entire practice. And so that's why RTM is so attractive, right? High ROI with low time investment. It is the lowest hanging fruit right now to help your practice financially and with patient outcomes. Now, there's tricks and tips on how to accelerate implementation, right? If you want to implement as quickly as you can, right? There's a couple tips I'll give you, I guess. The first thing is you got to have time, right? So block time for implementation, right? Schedule these meetings out for 4 to 6 weeks. Don't try to squeeze it all into your spare moments. Block time, block your time, block the clinical director's time so they can do this over the first couple, 1 to 4 weeks, right? And do group training sessions instead of having each provider watch their videos on their own, or have them watch it on their own and then get together like a book club and talk about what they learned. Again, hold them accountable. I see this so many times where the providers actually aren't even doing the training. And then you can just tell based on their questions when I have my implementation calls. I would start with the most enthusiastic providers, right? Let the early adopters prove that it works and others are going to follow them. That's probably the most effective thing you can do. I would probably set enrollment goals. So you look at your evals, how many patients qualify via their insurance each month, and then set a goal. Our goal is 85% of our qualified patients are enrolled. You might want to start with 50% or 25%. Make this a part of your evaluation template, right? You don't want to have to add documentation to your providers. This needs to be part of your templates. And you can do that. Very easy. This makes it routine and it's not an extra step for the provider. And then I think celebrating early wins, right? Having meetings, when the first patient gives positive feedback, which you're going to get if you're doing it right, share it with the team, right? We get them all the time on Google. People talk about, I love the video home program. I love the app. I love that they call me once a month and check in. They hold me accountable. I'm doing so well. Right. And then use the implementation support that we provide, right? We give you a step-by-step guide. We have all of our training materials organized. We have weekly check-ins during that first month, and then we have monthly meetings, and then we go to quarterly meetings, right? But use that support, make time for it, I think that's probably the most tips I could give you at this point. You don't have to figure this out alone, right? The fastest implementation we've seen is 2 weeks from the decision to the first enrollment. And that clinic was actually 11 locations, right? And so the average is about 3 to 4 weeks. The slowest is 3 to 6 months, which again, we see that too. But again, it's lack of focus, some staff resistance. But again, you should control the timeline, right? So I think that's an important element here. And if you want a detailed week by week implementation timeline or a checklist, I put that together for you. And I'm going to put that right below this video so you can just get it. You can download it. You can have it for free. And it's literally what I go through with every practice. It's what happens every single week, step by step. And so you can hopefully gain some confidence and direction. Who needs to do what? How much time requirements? What are the common obstacles? How to overcome them? We're trying to set ourselves apart at MovementRX as the highest support RTM vendor, right? We want to give you software. We want to give you support so you can really make a difference. And so download that for free. And you can look right below this video. I hope you enjoyed this video as much as I enjoyed making it. And if you want to walk through, talk about questions you have, just reach out. You can go ahead and go to our website and click the upper right-hand corner is book a call, 15-minute call with me. I'd love to talk with you over Zoom or the phone. And this is a game changer. Get on board. This is not going away. Thanks for listening.